leave the stage. But a boy like Ajoy, probably it will be not very safe to leave the stage only to him.
Yes.
We need one person from our side also, that is from Central Hospital, South Eastern Railway. And being this is on other side of 1/6, I think who will be the person? Sudesh Nadi, are you here? No. So okay, Dr. Somapika Chatterjee, please welcome. Please come to the dais. I think you will. So I leave the stage to both of you. Ajay is not only nationally, internationally, he has also developed his identity a little bit. And Dr. Somapika Chatterjee is our senior gynecologist in this hospital, but probably in this stage, managing all these things, she is the most suitable person. So over to both of you. You introduce yourselves and conduct the program. I am not
Thank you, Dr. Bhunia, for this warm welcome. And Somapika, yes, something to say?
Yeah, we are really feeling proud today that all of you have gathered to this, our beloved hospital. And I will fail to, in my duty, if I don't mention anything about Indian Railways, the way it runs, how we benefit from these kind of workshops. So we'll just show you a clip first, prepared by none other than Dr. Bhunia, and then we'll proceed with our job.
Railways, as I am, has united heart all over the country. Yes, the iconic movie Sholay, where he has taken this clip from. As railway, the train trudges along the villages as it joins small hamlets, passing through the streams, river. Well, that is getting dark. It has been known to be the best national integrator as it goes to small villages, the old engines that the railway worked just like our society which worked post-independence, trying to get us through. The country marches forward, and as it marches forward, going to the cities, taking in a lot of commuters, and of course the mass of our country, the cattle class as described by one of our politicians. But then, yeah.
Information, we carry around 25 million passengers every day. So you can imagine the load besides the goods which are being carried. So we really need a healthy railway manpower, and that is where our role comes in. Safety of the railway employees is safety of the largest transporter in India. And especially where ophthalmologists are concerned, we need good eyesight, especially for the running staff.
And as you see, the railway marches forward, modernizing itself, just like the services that the railway has been provided has been modernized. So the doctors have also modernized their service, and this is the national integration from Kashmir to Kanyakumari, from Gujarat to Nagaland, where the railway network is there. And as we see, railway now is just like railways marching forward and leaping, crossing the barrier, and that's it. It crosses, and this is taken over the superfast lanes of the trains, the railways. Just like that, we'll be describing how the surgical part of ophthalmology has been taken over by the modern surgery that the railway doctors should be showcasing us. This is, I believe, the newer double-decker trains as against the smaller, slow trudging trains that had been there until very few years back. I think I'll be just coming to the surgeries that the cataract surgery that used to be there earlier, what we'll be talking about, the bigger incision surgeries. This is how almost 8 to 10 millimeter incision, that's what we used to do until recently. The bigger incisions, as you can see, that's how you open the eyes until few years back, and manually remove that cataract as a whole through that big incision and put in a plastic, a 6 millimeter, 6.5 millimeter lens, and that's how it would take around 2 to 3 weeks to recover. Now this has been replaced by this surgery with a 2 millimeter small valve incision using the most modern machines, the microscopes that we have. We can handle this sort of cataracts. This is how the surgeons will be showing us. A cataract is, instead of taking out wholly, is emulsified, broken into small pieces. This is the steps that you'll be seeing repeatedly, at least 4 or 5 or 6 cases that will be showcased to you. This is one of those hard cataracts which earlier would not have been possible with the Phaco-emulsification also, but today with the modern machines that will be again showcased here, where the railways apparently acquired all these machines. The foldable lenses, the various type of foldable lenses which are available, the normal, simple spherical, the toric and the multifocal lenses, this will be again be showcased, and this will be by these juggernaut surgeons that you have here, I think the 4 of them. Well, it will be led by all of these, the younger generation who have been trained and who are well up to the mark and as best as anybody in the country. Yes, Shomapik. I think we'll go back to the OT, whether we can get the